When taking caffeine, it's important to follow the directions on the product package or as directed by your doctor. It's best to use this medication only as needed, and not on a regular basis. Be aware that this medication may be habit-forming, so it's crucial not to increase your dose, take it more often than directed, or use it regularly for a long time. If you suddenly stop using caffeine, you may experience withdrawal symptoms such as headaches and changes in mood. To avoid this, your doctor may slowly lower your dose. It's important to note that withdrawal is more likely if you've been using caffeine for a long time or in high doses. If you experience withdrawal symptoms, it's essential to inform your doctor or pharmacist. Over time, caffeine may not work as effectively, so it's important to discuss this with your doctor if you feel that the medication is not working well for you. Additionally, if your condition persists, worsens, or recurs, it's important to consult with your doctor. And if you suspect a serious medical issue, seek medical help immediately. Some common side effects of caffeine include nausea, vomiting, stomach upset, trouble sleeping, and increased urination. However, many people using this medication do not have serious side effects. If you experience dizziness, mental/mood changes, shaking, or fast/irregular heartbeat, contact your doctor. A very serious allergic reaction to caffeine is rare, but seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, consult your doctor or pharmacist. Please note that the information provided here is not a complete list of possible side effects. If you have any concerns, contact your healthcare provider for medical advice. Before taking caffeine, make sure to talk to your doctor or pharmacist if you have any allergies to caffeine or other similar drugs. It's important to discuss your medical history, especially if you have heart disease, high blood pressure, stomach ulcers, or mental/mood disorders. If you are planning to have surgery or medical procedures, let your doctor know that you are using caffeine. Older adults should be cautious about the side effects of caffeine, especially trouble sleeping. If you are pregnant, only use this medication if it's absolutely necessary and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using caffeine. When taking caffeine, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products containing caffeine may raise your heart rate or blood pressure, so it's important to inform your pharmacist about all the products you are using and ask how to use them safely. This is especially important when using cough and cold products, diet aids, or headache medications. It's also recommended to avoid consuming large amounts of caffeine-containing beverages such as coffee, tea, and certain sodas, as well as eating large amounts of chocolate while taking this medication. Additionally, caffeine may interfere with certain medical and lab tests, which could potentially result in false test results. Be sure to inform lab personnel and all your doctors that you are using this medication. When it comes to the optimal timing and dosage of caffeine, it's best to consult with your doctor for personalized recommendations based on your individual needs and medical history. If someone has taken too much caffeine and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of caffeine overdose may include stomach pain, changes in mood, seizures, and a fast or irregular heartbeat. Make sure to keep all of your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. Caffeine is a central nervous system stimulant that has been used for centuries for its stimulating effects. It is commonly found in coffee, tea, soft drinks, and energy drinks. Caffeine is used to increase alertness and wakefulness, as well as improve concentration and focus. It can also be used to alleviate fatigue and drowsiness. The recommended daily intake of caffeine for most adults is around 400 milligrams, which is roughly equivalent to 4 cups of brewed coffee. It is best to consume caffeine in the morning or early afternoon to avoid disrupting sleep patterns. However, it is important to note that excessive consumption of caffeine can lead to negative side effects such as anxiety, insomnia, and increased heart rate. It is always best to consult with a healthcare professional before consuming caffeine, especially if you have any underlying health conditions. When it comes to storing caffeine, it's important to follow the storage instructions on the package. Make sure to protect it from light and moisture, and avoid storing it in the bathroom. If you have any questions about storage, don't hesitate to ask your pharmacist. And remember to keep all medications away from children and pets. When it comes to discarding caffeine, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.